We're going to begin this hour with new reporting on the collapse of hospitals serving some of America's most vulnerable patients. In the latest part of our CBS News investigation, we're digging into the role of private equity investors in hospitals. So we followed the money. That's what they say you always need to do. Follow the money to San Antonio, where next week the community will be left without a crucial health care provider. How is that possible? Our chief medical correspondent, Jon LaPook, is here with more. Good morning to you, Jon.
Good morning, Gayle. Our investigation led us to San Antonio's Texas Vista Medical Center, which until 12 days ago was the place respiratory therapist Jessica Carrasco had worked for 8 years.
If you were to walk the halls right now, not to sound dramatic, but it feels like somebody's dying.
What do you mean?
You're walking through somewhere that used to have so much life, and it feels like someone's taking their last breaths.
For nearly 40 years, Texas Vista Medical Center has been the primary health care option for San Antonio's majority Hispanic South Side. When it shuts down on Monday, this part of town will have only one full-service hospital, 110 beds for about 500,000 people.
I feel like I need to apologize to the patients.
Jessica Carrasco was one of more than 800 employees told in March she would be out of a job when the hospital announced it was planning to close its doors.
The nearest hospital is between 12 to 15 minutes away, and if you're having a stroke or a heart attack, time is of the essence.
In 2017, a private equity-backed firm called Steward Health Care purchased Texas Vista. While Steward would operate the hospital, the land and building were sold to another entity called Medical Properties Trust, which has bought up the real estate of nearly 200 U.S. hospitals, often in low-income areas.
They recognized an opportunity, and that was private equity looking to sell hospital systems.
Investment analyst Rob Simone has advised clients to bet against the publicly traded company, but told us he doesn't trade on the company himself.
Medical Properties Trust does not employ any of the doctors or the EMS personnel. What they do is they provide cash, capital, to the folks that run the hospital. That's it. And they get back a check for rent.
On its website, Medical Properties Trust says this allows cash-starved hospitals to unlock the value of their real estate assets to pay for improvements.
They might say, we're giving money so that the hospital can actually invest that.
They would, but many of the hospitals are struggling and failing.
A CBS News investigation found a pattern of supply shortages at 14 hospitals where Medical Properties Trust owns the real estate. In Massachusetts, at least 16 vendors weren't paid on time, including a dialysis company that provided life-saving services to 5 hospitals. And by earlier this year, Steward Health Care had missed more than $650,000 in payments to at least a dozen different vendors serving Texas Vista.
Coordinators were having to phone a friend to let us borrow, a cup of sugar.
For example?
We provide patients with a non-invasive ventilation device.
A breathing mask,
Right, and if I don't have the hose to connect from the machine to the mask, I can't do anything for them.
On March 1st, the cash crunch exploded into public view when Steward announced it intended to shut Texas Vista in 60 days.
Would something like this, do you think, happen in a more affluent community?
No.
Councilwoman Adriana Rocha Garcia represents the San Antonio residents most affected by a closure.
My people, my residents, are 1 minute away from losing hope.
Steward, the owner, points to its disproportionately free care, higher needs patient population and says 25% of its patients don't pay for their care. It says the $5 million in annual rent it owes Medical Properties Trust represents only 3% of the annual operating budget and was absolutely not a factor in the decision to close the hospital. But in a recording obtained by CBS News, the CEO of the hospital did raise the issue of rent.
What is Steward trying to do? They're trying to get out of lease obligations.
I didn't know you could rent out a hospital. I was under the impression that we owned the building.
It's just infuriating.
Councilwoman Rocha Garcia told us when it comes to figuring out the financial reasons for Texas Vista's closure, she's in the dark.
Where's the transparency here?
There is no transparency.
You can't see what the income is, what the expenses were, nothing.
Nothing.
So as a regulator, I could stop it here.
Rhode Island Attorney General Peter Nerona told us last fall authorities around the country need more tools to protect hospitals. His state passed an unusual law giving him the power to scrutinize hospital transactions and block a potential real estate sale.
Laws on the books like that allow us to intervene to make sure that the healthcare system is going to be one of quality, that's affordable and accessible.
Without those laws, he told us, it can be hard to follow the money. One thing is clear. For executives at Medical Properties Trust, buying hospital real estate has been lucrative.
Hello, I'm Ed Aldag with Medical Properties Trust.
According to the company's SEC filings, from 2017 to 2021, CEO Edward Aldag's salary, bonuses, and stock awards amounted to a total of about $70 million.
It felt like it became less about people and more about profits.
Edward Aldag declined an interview. In a statement, Medical Properties Trust said it has no involvement in operational decisions at the facilities it owns and denied its lease agreements have caused any of them to cut services or fail. Steward Health Care said it has invested close to $2 billion in its 39 hospitals, including $100 million in Texas Vista. Steward says without its commitment, Texas Vista would have closed years ago. Jessica Carrasco told us she's lost the place where her grandparents sought care and where everyone knew her daughter's name.
It's very emotional.
Home place, yeah.
So what happens to the rent payments when the hospital closes?
Well, we've been told that the rent payments are still being made. Remember, Steward is a big company. It's got dozens of other hospitals, other assets. But, you know, this is the point of transparency. We can't look behind the curtain here and say, well, what does the balance sheet look like? What money is going where? So we're left wondering, I'm not sure exactly what's going on financially.
I know you've done a couple of jaw-dropping stories on this topic. Are you seeing a theme here, Jon?
Yeah, for me, the two themes are, number one, what happens when private equity brushes up against health equity? And the second is this issue of transparency.
Right.
We just don't know what's going on. And I go back to what Attorney General Nerona in Rhode Island said to us. His advice for everybody watching this around the country is he has in Rhode Island the power to, when there's a transaction involving a hospital, to open up the books and to look at things and to examine it. And he thinks that people around the country need that same tool.
For sure.
So that it's just more visible. Shine light on the process and then say, you know, okay, what's going on?
Now what
Is
do
it
we do?
okay?
Yeah, a hospital may be a private company, but it's serving a public, and that public's health is on the line. Dr. Jon LaPook, thank you very much.
Thank you.
Really eye-opening.